My role here today is to talk to you about the importance of exercise in cancer management, or the importance of exercise in your health in general. So, what I'm going to talk to you about is distinguishing the difference between physical activity and exercise. I will spend a bit of time talking about aerobic exercise, the general benefits of exercise, and specifically the benefits of exercise in terms of cancer care, cancer outcomes. There are some interesting researches in this area. I will then take you through some important findings from the studies that have been done, and I'll summarize with a take-home message in a nutshell, something that you can do to help yourself with exercise, but also to help your outcome if you were to develop cancer or you're going through cancer treatment at the moment. It is important to be able to distinguish between physical activity and exercise. You know, a lot of patients that I see, a lot of people tell me that, oh, I'm very active. I walk all the time. I walk from A to B during my job. But there is a difference between being physically active and actually doing exercise. And the key difference is, with exercise, it's about having a structured physical activity program. So it's not just, walking, a few minutes or even a few hours, but without a structure to it. When you're exercising, you're doing particular physical activities, whether it's burpees or squats or press-ups or planks, whatever it is, over a determined period of time, aiming to get your heart rate up and get your cardiovascular system working hard. That is the difference between physical activity and exercise. So a lot of people who are physically active don't get the physiological benefits of exercise because there's no structure to it. There is no outcome goal that they're going after. When we talk about exercise, there are two main types in general. You have what we call aerobic exercise. That is exercise that requires the use of oxygen and can be sustained over long periods of time. And you have anaerobic exercise. This is exercise without use of oxygen or with very little use of oxygen and cannot be sustained over long periods of time because you get buildup of lactic acid and muscle fatigue a lot easier. So the benefits of exercise that I'm going to be focusing on is aerobic exercise. Exercise with oxygen. This is what has been shown repeatedly in medical literature and in scientific literature to actually improve one's health. And this is where studies about exercise in cancer have focused on. So aerobic exercise actually helps to condition your cardiovascular system. It helps your body to work better for longer. Aerobic means with oxygen, so blood circulates more and the lungs use more oxygen as well. It uses a combination of energy from various sources such as carbohydrates, fats and protein in order to burn the energy that you need whilst doing anaerobic exercise. It is recommended that we all do at least 150 minutes a week of aerobic exercise or activity, or when you do it in one go, you should be aiming to do at least 20 to 30 minutes in a block. So you do structured aerobic exercise in a block for 20 to 30 minutes. Now, when you do aerobic exercise, essentially what you get is a teamwork between your skeletal muscle, because you are using your muscles as well, and so it's teamwork between your skeletal muscle and your cardiovascular system. It helps you to get stronger, fitter, and you're able to exercise for longer and longer the more aerobic exercise you do. So I want to touch on some of the benefits of aerobic exercise. So aerobic exercise helps you to burn fat better, helps you to lose weight better, more efficiently. It reduces your resting heart rate. So marathon runners typically have heart rates of 40 to 50 beats per minute. It increases your stamina and strength, helps your heart and lung function to be much better. It reduces your risk of high blood pressure, diabetes, and other heart disease in general. It also helps you to have a better mood and reduces your levels of anxiety. It increases, importantly, your quality of life and your life expectancy. So direct benefits includes improvement of your respiratory and cardiovascular function, as I mentioned earlier. It also improves the strength of your muscle. There's something called sarcopenia, so beyond the age of 30, your muscles start to deteriorate, which reduces your skeletal function, and hence a lot of older people at high risk of falls and hip fractures. And hip fractures is one of the biggest causes of death in the Western world. Okay, so regular exercise helps to strengthen your muscle, helps to strengthen your skeleton, and prevents the risk of falls. So aerobic exercise is really, really important, but there are also some other important added benefits. Repeated bouts of exercise lead to a multiple organ system effectiveness. It helps all your organs to adapt and function much better. It improves your oxygen delivery and utilization by various organs. It also improves something called VO2 max. VO2 max is your maximum oxygen consumption with incremental exercise. You know, the higher this is, the better you can tolerate exercising at higher increments. It also improves, importantly, something called your mitochondrial function. So as human beings, we're made up of cells. Each cell has a mitochondria. The mitochondria is the powerhouse. It's the energy delivery system of all our cells. So in essence, it is the powerhouse, what keeps us going. And regular aerobic exercise improves the mitochondrial function. Regular aerobic exercise also helps the metabolism of glucose, the circulating level of insulin, which helps to metabolize glucose. It also helps with something called angiogenesis, which is the development of new blood vessels, and helps to positively impact the levels of cytokines. Cytokines are chemicals that are released in various contexts, including in inflammation, in infection, but also in our immune response against tumor cells. So the effects of exercise are wide-ranging. They're not just limited to our skeletal muscle, our lung or heart function. They have wide-ranging impact on our whole bodily system. At this stage, you might be wondering, well, what are some of the examples of aerobic exercise? So this is any activity that increases your heart rate and quickens your breath. So it's not just walking for hours and hours at end during the day, but it's walking fast enough so that you get out of breath, okay? And you feel that you're really needing to take in a lot more oxygen and your heart is beating faster. So examples include, running, jogging, cycling, swimming, walking fast, as I mentioned, hiking, rollerblading, using cardiovascular machines in the gym, such as treadmill, cross trainer, elliptical machines, climbing the stairs up and down really fast. Rowing is also another form of aerobic exercise. Dancing, skipping is a form of aerobic exercise. Playing sports like football, basketball, hockey, volleyball, anything where you're sort of running back and forth consistently, rather than not doing 100 meter sprints, but not doing 100 meters sprint, but running consistently and keeping your heart rate up and using a lot of oxygen. These are all forms of aerobic exercise. Well, I hope I've been able to convince you beyond the general awareness that exercise is important, to actually take home with you today that exercise is very, very important for your general well-being, and it is something that you should start doing straight away regularly, in particularly aerobic exercise. But the question, especially in terms of the conference that we're attending today, is whether exercise actually has a role in the management of cancer, and that's what I'm going to focus on next. Over the last 2 decades, there's been a lot of activity in the scientific community to actually look at the impact of exercise on cancer management. There is an inverse relationship between self-reported levels of activity of exercise and the incidence of various forms of cancer. So meaning, those who report themselves to be regularly active, those group of individuals have lower incidence of various types of cancer. And furthermore, there's also been studies showing that patients who have already been diagnosed with breast, colorectal and prostate cancer who are very active actually have a better outcome than less active patients. Some of the other additional benefits that patients with cancer have reported as a result of doing regular exercises: reduced fatigue, improved quality of life, and better physical functioning overall, better mental health in terms of their approach towards their cancer diagnosis also. Various observational studies have shown that exercise reduces the risk of cancer recurrence. So if someone who's had cancer, been treated, in remission, it reduces the risk of cancer coming back. It reduces the risk of cancer-related mortality. Now, preclinical studies and animal studies have also shown that exercise regularly improves the immune response to cancer cells, because our immune system recognizes cancer cells as being foreign, and without chemotherapy or radiotherapy, what starts to attack the cancer cells before any of those is our immune system. And regular exercise improves that immune regulatory process. It also makes the anti-tumor environment much more toxic for the tumor cells. And let me explain this. When a cancer develops, you have lots of cells growing in unregulated manner. In order for them to survive, they need oxygen. So these cells produce a lot of chemicals that makes new blood vessels, but it's not organized in the way that our arteries and veins are organized. It's in a very disorganized manner. Okay, so if you're exercising regularly, what you actually end up doing is you end up diverting oxygen. This is just at a basic level. You end up diverting oxygen from those cancer cells, which find it a lot more difficult because their blood vessels are a lot more in disarray and disorganized. And oxygen and nutrients get sent to your skeletal muscles, your brain, your heart, other important organs that need it more. So regular exercise deprives tumor cells of important oxygen and nutrient that they need to carry on propagating. But beyond that, it also affects the cytokine, those chemicals that I mentioned earlier, and the actual immunity against the cancer cells. It makes the environment really, really toxic for them. So exercise is really, really vital. I think one of the key things though is whether exercise actually helps the radiotherapy and chemotherapy treatment that patients get. Because ultimately, exercise by itself isn't going to cure you of cancer. But does it actually make your response from radiotherapy and chemotherapy much, much more effective? And because it isn't easy, I accept it isn't easy to be exercising when you've got serious illness, a diagnosis like cancer, which in itself can make you feel weak, fatigued, and chemotherapy and radiotherapy can make you feel weak and fatigued. And in your mind, you're trying to convince yourself that I should go and exercise when I'm feeling really weak and fatigued. Okay, it's very, very difficult. But if you knew that exercising regularly, despite feeling that way, will improve your response to the chemotherapy and radiotherapy that you're going to have, it will probably encourage you more to rise above that fatigue, the discomfort that you're experiencing. So go and exercise in spite of the obstacles, in spite of the feeling of no energy, because ultimately it's going to improve your response to treatment. And you will be glad to know that there is a lot of encouraging evidence coming from the scientific literature. So it is biologically plausible, as I explained earlier, but what the research is actually showing is that exercise helps to modulate several factors that are key to cancer treatment. Okay, it increases the sensitivity to chemotherapy and radiotherapy. It also alters the tumor microenvironment to such an extent that it reduces the oxygen level, it reduces the blood flow to the tumor cells, it impacts on the use of nutrients by the tumor cells, and it also heightens the anti-tumor immune response. So there is a phenomenon called oxidative stress, which is a biochemical stress on the body as a result of things like infection and chemotherapy and radiotherapy. When you have an oxidative stress, you get an imbalance in your circulating chemicals to an extent where it favors reduction in your neurocognitive function, so your brain function. Okay, and studies have actually been shown that exercising regularly improves the balance of these chemicals to cause an antioxidant environment. And in women, for example, with breast cancer, there have been studies that have shown a favorable antioxidant environment that improves their neurocognitive function, and this has also been shown in other types of cancers. So exercise and chemotherapy together reduces the levels of inflammatory biomarkers or chemicals that helps people receiving the combination of exercise and chemotherapy or in animal studies to actually have an improved cognitive function. So your brain can function much better compared to if you weren't exercising regularly. So far, what a lot of the studies are showing is that exercising at least 3 times weekly, so following a structured program, not just being busy and being active, but following a structured exercise program. And remember, it only needs to be about 30 minutes a day. Start with what you can. Perhaps 10 minutes, 15 minutes, 20 minutes, 30 minutes, and build it up gradually. As your muscles get used to exercising incrementally, they get used to working for longer with less oxygen, with less carbohydrates and other energy resources, and you develop a tolerance to increasing levels of exercise. I want to give you some take-home messages. Now, exercising regularly alone will not stop any of us from getting cancer of any type, okay? But if you exercise regularly, your chances of developing cancer will be much less because of the reduced incidence. Your prognosis, so your outcome following a diagnosis of cancer, will be much better because you're more likely to respond better to chemotherapy and radiotherapy. Your innate, your natural immune response to cancer cells will be a lot better as well. So regular exercise will help with all of that. If you've also been cured of cancer, the risk of recurrence of developing the same type of cancer again will be much less if you continue to exercise regularly. And so, look, what I think we all need to do is to combine exercising regularly, whether we've ever had cancer or not, and also being aware of our body so that when we develop new symptoms, we can present early to our doctors, our clinicians, so that an early diagnosis can be made. So imagine if you present very early and the cancer is diagnosed super early and you've been exercising, so the early diagnosis before cancer has reached a greater stage or has metastasized to distant organs, as well as regular exercise will positively impact on your response to chemotherapy and radiotherapy and on your general health and well-being also. So look, I hope the information that I've presented today has been clear. I hope you take it on board, and I wish you all the best on your journey towards becoming a master of your own health.